everyone, welcome to your Goshen TV's Pandora Box. Today we're having health talk and our guest is Dr. Oluwadare Adepetu. Thanks for joining us on Goshen TV, sir.
Thank you. Thanks for having me.
Dr. Adepetu has been taking us on a journey through health and fertility. We've talked so much, and if you've missed any episode, please do click on the buttons and see the previous episodes. Today, we'll be talking about male fertility. So, over the years, it's been a problem in the home, no babies for a year or two, and the woman is told, go back home, you can't make babies. But looks like the narrative is changing today, with men coming up to say, okay, the problem is not with my wife, it's with me. It's not the woman. So we're getting to see more cases of male infertility. What, please, could be responsible for the increase in these statistics?
Thank you so much. Just like you rightly said, more men are coming forward now because more of them are coming forward for examination and for medical assessment. So we are discovering more and more problems with men that relates to the inability of the couple to achieve pregnancy. Now, when you talk about male factor infertility, the chief cause is abnormality with the semen production. Now, the fact that is no longer seen as the problem of the woman in our society. Now, more of the men are coming to the hospital with their wives. This might be the reason why it appears as if there is increase in male factor infertility, not that there is actual increase, but we are detecting more and more cases because more and more people are coming forward. That's why it appears as if there is increase. Thank you.
Okay, thanks. That's quite revealing. Now, what are the basic causes of male infertility?
Yep. When you look at the causes of infertility, generally, just like we have mentioned earlier, about 30% is due to the male factor. Now, like I said, the chief cause of the male factor infertility is abnormality with the semen. Now, when you look at abnormality with the semen, that's the sperm production. Broadly, we can classify this into 3 categories. The abnormality that occur, that's pre-testicular problems, testicular problems, or post-testicular problems. Now, talking about the pre-testicular problems, these are the abnormalities that occur before the production of sperm cell, before the production gets to the level of the testicles. Now, what are the problems that can occur before that time? These are mainly hormonal problems. Men not producing enough hormones, that's those who are producing normal quantity, or men not producing at all, or those who produce male hormone, but their male hormone don't get converted to the active form. The male hormone is testosterone. Now, the active form is 5-hydrotestosterone. Now, some of them don't produce at all. Some produce low quantity of male hormone. Now, some of them produce normal hormones, but they don't get their hormone converted to the active form. Now, men in these categories, for those who don't get it converted to the active form, they may manifest with no sperm production because it is the active form that acts on the testicle. Now, some of them produce this active form in lower amounts. Those people who produce low sperm count, those are people that manifest with low sperm count. Then some of them produce, and some of them don't even produce this male hormone at all. So those people will manifest with no sperm production. Now, for men in these categories, when they come to hospital, there is treatment for them. Once we identify that they are in that category and we make this hormone available or the active form available to them, they go back to normal.
Okay.
Now, for people, the second category is testicular problems. Those whose problem is at the level of the testicles. Now, they have normal hormones. You see them, they have features of a normal man, that's features of virilism. They have beards, they have frontal hair recession and all that. But the receptors for this hormone on the testicle is absent. It's just like trying to plug your device to a socket. Now, the hormone is your plug. The receptor is that socket. Now the socket on the testicle is absent or not functional. So these people produce normal hormones, but there is no receptor for this hormone on the testicle. So the hormones will not work on the testicle to produce sperm. That's one problem. Now, some people engage in factors that we have discussed in previous edition. Men who engage in long distance driving, men who wear tight-fitting underwear, men who smoke, those who take a lot of aqua, those who work in hot environments. These people, they make the testicle to work in an environment that is not favorable, that is not good for sperm production. Because if you look at the testicle, it functions well within a narrow temperature range. That's why the testicle is not within our body like the ovary in women. It's outside the body. And when you look at the sac that contains the testicle on a very cold morning, discover that the sac will shrink and bring the testicle close to the body so that the testicle is not too cold. It gets heat from the body. Then on a very hot afternoon or hot weather, if you check this skin, it looks like rag, it sags, such that the testicle is away from the heat of the body so that it's not too hot. Now, if you now see men who now put this testicle in between their laps and drive long distance, that is like those people who are cooking their testicle in coats, or those who wear tight-fitting underwear. The testicle is trying to get away from the body. You now use your pan to bring it close to the body. Or those who work in hot environment, those who work in environment with radiation, those who work with instruments that vibrate, those who work in petrochemical industries. These are people that are at risk of testicular problems. That's those who can develop testicular problem with sperm production. Now, the third category is post-testicular problems. Now, for those with post-testicular problems, these are people with, it can be congenital problems such that they don't have the conduit, that's the vas deferens, that brings the sperm out after production. Now, they need to bring it out during sexual intercourse into the woman. Now, they don't have this pathway. Or those whose passage, this vas deferens, have been blocked due to previous infection, most of it sexually transmitted infection, or those whose passage have been narrowed by these by infections. So these people, they produce the sperm, but they cannot bring them out. So when the man is having issues with sperm production, he should come to the hospital. We need to make diagnosis to know the category he falls into before treatment can be made available to them.
This is Goshen TV, broadcasting independently from Port Harcourt, South Nigeria. We've come into the global media space to take a prime place to do the business of journalism and broadcasting in different and exciting ways.
On our platform, you will watch breaking news, special interview programs, for example, the Pandora Box, Stars, News Digest. There will also be Gist Hour and many more.
Goshen TV will offer you a platform to advertise your goods and services, as well as provide the opportunity for the coverage of your special events. To enjoy our various programs, follow us on YouTube, Instagram, Facebook, and Twitter. Goshen TV. This is The Tonic.
Still on causes of low sperm count and male infertility. What have phones and laptops got to do with it? Because we've been warned, don't put your phone in your pockets, don't put your laptop on your laps and all that.
We have just mentioned heat has not been friendly with the testicle. So those who put laptops on their laps, just like the name sound, laptop, and the thing is there for a very long time, you know this computer generates heat. That's one thing. Then we talk about radiation. For your phone in your pocket to receive call and send call, to receive internet message and all that is through internet connectivity, radiation to some extent. So these are things that affect the function of the testicles.
And I'm quite puzzled talking about low sperm counts. We understand it takes only one sperm to fertilize the woman's egg. So why is low sperm count an issue? I know one would serve.
Yes, I will borrow a word of one of our professors. he said human reproduction is wasteful. And that's the truth. You only need one sperm cell to fertilize an egg. Now, the journey of that sperm cell from being, after it's produced in the testicle, now gets stored in the epidermis, then during social intercourse, they move out, pass through the vas deferens, and they are deposited in the vagina. Now, in getting there, the vagina is an acidic environment. I'm trying to talk about the hazardous journey of the sperm cell now. The vagina is an acidic environment because the woman needs to be protected. That's why the place is acidic. Now, the sperm will need to negotiate that, pass through that, enter into the cervix. Now, the cervical mucus plug is there to act as obstruction. Now, the sperm succeed in passing through that place, enter into the womb. That's another environment. Move away from that, enter into the tube. That's another problem. Now, pass through the fallopian tube before it gets to where the eggs are. So, in doing this, a lot of them will die by the way. So that's why the man described human reproduction as very wasteful. Wasteful in the sense that if you put your hand, if you take a drop of the semen and put on a glass slide and you watch, you view under microscope, it's like taking the area view of stadium when they are playing football and the host team score their winning goal at the dying minute and you see everybody jumping. So that's what you see there in the normal situation. So it's numerous. They produce it. The men produce sperm in millions, and they only need one to fertilize the egg.
Okay, that's such a puzzle. Now, I'm thinking now with the increase in this challenge, what are the solutions? What a man should do?
Well, if a man of all these risk factors that we have highlighted, you need to stay away from it as much as you can. Stay away from smoking. Stay away from indulging in alcohol, tight-fitting underwear. Try as much as possible to stay away from hot environment. Then those who work with instruments that vibrates as much as possible, take break, then go back, stay away, then go back. Those who work in petrochemical industry, I don't know what those people will do. I won't ask them to quit their jobs. Then when this problem is noticed, come to the hospital, come for assessment. We need to know what the problems are or what the problem is before we know solution to the problem.
So this is really like being between the devil and the deep blue sea. Sometimes career just exposes you. And are there supplements or are there foods that we can take, that men can take rather, to improve the quality of the sperm produced?
Yes, when it comes to career and I'm sure all those companies too put in place measures to protect their staff, not that they just leave them like that. For instance, people that work in environment with radiation, they try to give them protective jackets, and those who work in petrochemical industries too, I'm sure they must have put in place one or two things to protect them. Now for food that they can eat, okay, foods that are antioxidants, generally fruits, they are rich in antioxidants. Those ones can help them to clear all the oxidative radicals they have generated in their body in the course of working in their place of work. Then fruits generally that end with nuts, they are okay for them, like walnut, coconut, and all that.
Like
Groundnut with nuts that does not belong in that category actually. But people have talked about food with nuts that are okay for them. But then generally, all food that are rich in antioxidants are okay, like fruits generally.
Thank you very much, sir. Hi, viewers. This is your Goshen TV, and you're listening to Dr. Oluwadare Adepetu of Novel Hope Medical and Fertility Center. Remember to subscribe to our YouTube channel and like all our social media handles as written on your screen. See you.